No, that's good. Good afternoon and welcome to this virtual edition of Medtalks. Today's topic, accessing home care services here on the Sunshine Coast. My name is Joanna Piros, coming to you from beautiful sunny Gibsons. I'm proud to be on the board of the Sechelt Hospital Foundation, and I am very happy and privileged to be the MC for these Medtalks, which I think are so important to our community. I would also like to acknowledge that we live and work on the unceded homelands of the Sechelt Nation and all First Nations people that have called this land home. Support for today's Med Talk has come from our friends and partners at the Sunshine Coast Credit Union. So the first thing I need to say for today's Med Talk is that in a world that seems to be extremely uncertain and troubled, and we may feel powerless to do anything about it, it is awfully good and heartening to know that there are people that are looking after us. And today's focus is going to be on those people who look after us in our homes, the home support, the home care team. As always in Med Talks, we do welcome your questions, and we would like to receive those by way of chat. We will go to those when we get to them, probably just about 10 minutes to 5 o'clock or something like that. So please use the chat feature and we will collect your questions and attempt to answer them. It is my pleasure today to introduce not my guest, but my co-host. I'm going to call her Shari Myhill-Jones, and Shari is the manager of home care services on the coast. And Shari, thank you so much for being here today. We have done our best to create some maps and graphics to try to shed some light on how all of these different roles in home care fit together, and you will be our guide to introduce us to the various people in those roles. So I am inviting you in as my co-host to take it away.
Thank you, Joanna. Thank you for inviting me and our team from home care to tell you and the community a little bit more about home care. So I'm hoping that in our presentation today, we'll be able to help everyone listening to understand the services we offer and how to access them from our two offices. We have one in Gibsons and one in Sechelt. And we'll explain how we work in collaboration with the Sechelt Hospital, Mental Health, Shorncliffe, Totem, and Christensen Village. So at my office in Sechelt, I'm right beside the main door. And so I can often kind of hear what goes on when people come in. And it's not probably at least 3 or 4 times a day, the door will open and I'll hear somebody say, "Am I in the right place?" So the answer is you are always in the right place, even if it's not home care that you're looking for. So we're often the first stop in the journey to finding the services on the Sunshine Coast that you require. So our admin team, Shanae, Jade, and Sandra, who are a bit camera shy, fortunately, and don't appear today, they're the 3 people you're going to meet when you call or when you come in to our home care office. And they will make sure that you're directed to the appropriate service. So when I joined home care about 7 years ago as a case manager, after many years of working in the long-term care world, I had no idea what supports were offered and how the system worked. I'm an RN, you'd think I would know, but I was very much confused how to access help and what kind of help is there and how much does it cost? How do I get on the list, which I was surprised how many people use that term. Some people think they need to get on the list at like 50, sort of like we do when we have a child and we have to get on the daycare list. It's not like that. Our team will tell you a bit about their roles and how they can support you and through all these different systems and help you thrive in your home and the community. So one of the themes I've heard many of our staff speak of the desire to support clients remain independent in their own homes. Home is where all of us are at our best. Our goal is to provide you with the services and support to maintain your health, safety, and quality of life in your home and your community. So I'll get started. I'd like to introduce our case manager, Monique. And Monique is an RN who you'll likely connect when you first reach out for help. And often you don't know where to get the help, what kind of help. You just know that you need some help. you need some help with your husband, your mom, your dad, and Monique is likely the first person that you're going to speak to who will help demystify the healthcare system and support you, your families on your journey through what seems like what Joanna said could be a confusing and complex system at times. So Monique is next.
The benefits to having home support would be predominantly being able to stay home as long as possible. Everybody really, I think if you asked anybody, they would say that their plan is always to be at home. They never really foresee leaving home. We are often that first point of contact for people in the community that are looking for information about services, what's available, how to get help, who to connect with to start that service. We work with clients primarily to keep them in their homes as long as possible. So looking at what their needs are, assessing them, determining what their needs are, and putting in service to support them in whatever capacity that they need, predominantly around things like personal care, medications, meal assistance, and then we liaise with other disciplines in the department as well, with physiotherapy, occupational therapy, the dietitian, social work, to also, determine if they have other needs that need to be supported. So we connect them with those disciplines as well. We are reached either through self-referral, through calling the office, or physicians often will refer through to us. Family members, friends will often reach out saying that they know somebody that is in need of service. And we also receive referrals through the hospital. So there's a multitude of ways that we'll be getting referrals. And then so part of my role as a case manager is I also do intake. So I receive the majority of those initial referrals. And I will call then the individual to find out, based on what that referral says, what their needs are, and then we begin the conversation there. In terms of cost of service, yes, we do a financial at that time of assessment as well, and determine if for home support, determine if a cost applies. And for residential care as well, we also do that calculation for them so they understand what they'd be paying on a monthly basis. So for example, I believe it's stated that for assisted living, it's 70% of an individual's income would go to the cost of assisted living, 80% for residential care. Home support is determined based on income, either a single or a couple. So if it's a single individual, not married or widowed, it's that individual's income. We'll do the calculation. If it's a couple, then it's a combined income, and then we'll do the calculation and let them know what the daily rate is. It gets a bit confusing around that rate of what someone pays for home support, because we have an hourly rate that we would charge, or the person's daily rate, and we charge whichever is lesser. So for example, our hourly rate is approximately $38 an hour. If a person has a daily rate of $50 a day, we would charge that hourly rate until we reach their daily rate, and they would never pay more than the daily rate. Care in the home it varies, and again depends on the individual's needs. It could be anywhere from, if somebody is just needing a medication check to ensure that they're on track, that could mean a 15-minute visit daily. Potentially more frequently, depending on how many times a day they have medications. If their beginning service with us is a weekly shower assist, that can be anywhere from a half an hour to an hour, again, depending on what their needs are. If they are needing a bit more support, so maybe daily visits for personal care, daily visits for meal assistance, then we might be seeing them daily for a half an hour, maybe multiple times a day, half hour, 45-minute visits. It really just depends on what their needs are. If an individual has high physical needs where they're being supported with a lot of equipment in home, such as a ceiling lift, then we could potentially have 2 workers in And then again, depending on what their needs are and how long it takes to provide that care, they could be hour visits multiple times a day.
Their needs are and how long it takes to provide that care, they could be hour visits multiple times a day.
Okay. Thank you, Monique. So once Monique has done this assessment and set up the home support that she just described, she will continue to oversee all of the care and make any changes that are necessary. Once a home support is set up, then our LPN supervisors take the lead, and they are, I would consider them the lead of our community healthcare workers, who will meet later. And our LPN supervisors play a very important role in ensuring that the home support program runs smoothly. It's a 7-day-a-week program, so it's very important that they're here at all times to address any of the problems that come up, any concerns with clients. So the LPN supervisors are doing everything from making a sandwich for the client to providing some simple wound care, catheter care, to even searching for a client who isn't home when we come to visit. So I'll let Sarah Skeeth tell you a little bit more about what her role is.
My role is to supervise the community health workers that go into people's homes and assist them with whatever they need as far as care goes. What I do is if there are any barriers to care that the community health workers are finding, I can go in and troubleshoot. I'll go in and visit, and through my findings, I'll see whether or not there needs to be an OT assessment or a PT assessment, or whether family needs more involvement. Or my job is kind of to connect people. So the community health workers are the eyes and the ears, and they're really, really good at noticing everything the client is doing, especially when someone's doing something out of the norm or something's gone sort of wrong. And so they'll make me aware of that, and then I have to decide where that information goes. So it could go to a family member, it could go to the social worker, their case manager, whatever different person is going to be able to solve that problem best to keep that person at home. So that's my job, is to sort of make that connection between the client, the worker, and the person that can help solve that problem. I start out every morning with a phone call from one of our clients, and she calls at the same time every morning, and she always asks the same thing, and I'm the first person that she talks to, and I tell her what her day is going to look like, and we chat for a little bit, and then from there, it can be anything. I could be out looking for a lost person on the street. I could be doing wound care. I could be driving supplies up to Pender Harbor. There's just so many different things that go into doing my job. And that's why I love it, because it's not sitting behind a desk all day and looking at words and notes. It's you're out and you're about and you're doing different things. I've worked in acute care, and that's very regimented. It's a different style of nursing. And I've worked in long-term care, and that's also very regimented. And you're working really tightly in a team. You don't have a lot of autonomy there. But in home care, you're off on your own, and you can find yourself into some pretty crazy situations. and you're on your own, and hopefully you have cell service. But you can find yourself like really in the middle of nowhere, because it's the coast, right? We've got some very rural areas, and the person maybe doesn't have neighbors for support, doesn't have family that live in town, and you're their only source of contact sometimes, their only source of support. I think the majority of what our clients need at home is help with dressing and help with sort of getting started in the morning, making sure they're on track with their pills, getting dressed, having breakfast, and somebody to talk to. A lot of it is waking up and there's somebody else there in the room with you, and you're not sort of facing the day all by yourself. So I think that's a big part of it too, is the mental health of just having a connection with another human being. So respite services are a chunk of time that we offer to the caregivers. so that the caregivers have 2 or 3 hours in their day that they can go out to appointments or shopping or coffee or a movie or whatever they want to do with those hours. They can just go out. It's really hard to leave a loved one at home, because if you're leaving them at home and they're by themselves, you're not having any fun, because you're always worried about whether they've fallen or if they need to go to the bathroom or whatever you're worried about, and you feel guilt for leaving them behind alone. And you shouldn't have to feel guilt, because you're a person too, and you need to look after yourself or you're going to burn out pretty fast. You need to sleep and eat and have time with your friends and have time for yourself. And so the respite allows a really short period of time, relatively short, that person can go out and do whatever they need to do.
Relatively short, that person can do whatever they need to do.
Sarah captures what we do in home care so well. Takes us to our community health workers who Sarah works with. And when I think of home support, I think of community health workers. These are the remarkable people who come to your home, sometimes multiple times during one day, to make sure you're clean, you're comfortable, well-fed, and safe. Through COVID, the heat dome, the floods, the snowstorms this year, our care aides, or CHWs as we call them, continued to show up to work. They made it through to homes that were blocked by trees, snow, and they're a dedicated group that continued to provide services right from Port Mellon all the way to Earls Cove. They're behind the scenes. They're doing important work that allows us to remain living independently. I'm fortunate to have Kelly Spain on our team.
I have really come to love it. I feel that keeping the people in their homes for as long as possible is really a help to them, their families, and the entire healthcare system. It makes a really big difference. On the entire Sunshine Coast, as far as I know, the last number I had heard was that there was 60. And we have 3 different offices or areas throughout the coast. We have Pender Harbor and Sechelt and Gibsons. And ultimately, it's our schedulers who make our schedules for those areas, and that can change daily. We never actually know where we're going until we arrive for our shift, because it can change so drastically between clients maybe going to the hospital or a community health worker being off ill, for example. But yeah, ultimately it's our schedulers, and they do a wonderful job, and kudos to them, because it is a stressful job, because they deal with not only the community health workers, but all of the clients and their families, and the case managers and so forth. Well, generally, like the very first time that I go in, if I have an idea that it might be their first visit, I make sure I introduce myself. Actually, at every single visit, I always introduce myself as I come in, and then if they're ever unsure, I'll go through the list of why we're there and how we're there to help them. Lots of people can be resistant initially to having personal care because it's new to them. But after a couple of times of accepting care, they realize that it's on a professional level, and we most of the time end up talking through all of the care, and neither one of us kind of realize that what's been done, and we end up having a nice visit. And so it's a good distraction, but it's also a good way to get to know people and their stories and who they are and what their life has been like. And that's, I actually do a lot of talking with my clients throughout the visit, and because I really enjoy getting to know each and every one of them. A lot of people don't realize that the respite option is there for families to have some time so that they can have a break, because caregiver burnout is a real thing. It actually happens to all of us at some point in time, so we have to remember to do self-care as well. Another thing that I would say that lots of people don't realize with a community health worker is that our jobs can be very challenging, especially when we're dealing with dementia clients. We have to be on our toes every time because their mental abilities can change from day to day, and sometimes they can be very resistive, and you're always listening and watching and processing on what the best way to deliver care is.
Who organizes all the CHWs? Community health workers. Figuring out their routes, where they're supposed to go, who needs to be visited each day, who fills the shifts when the staff call in sick. During our multiple weather events, the team came in early, they worked around the roads that were open, and made sure everyone got their breaks and were safe. And Daria Ho and her team of schedulers come in 7 days a week, and they make sure that everyone is safe and our clients are visited. I welcome Daria.
My start of my day, yes, 6 o'clock, I come in. First thing I do is, I guess my scheduler and I, we check for any sick calls. So if somebody phones in sick, first thing we do is try to cover that by phoning around, see who we have available, casuals, people who are already working, so they're overtime, day off overtime. It's just, you just go down the list, right? And then you try to get it covered. And if we don't get it covered, we try to minimize, leave as little amount of clients as we can, like in the area of, let's say, Sechelt, say somebody phoned in sick in Sechelt. Then the LPNs will help out to do those clients, right? So there might be little med people. We try not to cancel clients. When I say that, it's because, everybody needs to be seen, really, right? So when that actually happens, we have to look at the emergency code list. So every client has a URP, they call it Urgent Response Code, and they base it from 1 to 5. And so if they have family around, then they can be canceled. The family can be. So 1s and 2s usually do not get canceled. So 3 onward, we can look at that, right? So work from 5 down, basically, is what we're doing. It's quite a juggle. It's never a dull moment, It's just, you just do what you can, basically, every day. And if there's no sick calls, you go, yay. For us right now, we're so short-staffed that a lot of agencies are being sourced to take our clients, right? In order to cover for the demand, right? So when the case manager, like I say, asks for a request from us and we're unable to provide, they will source an agency, and then if they can do it, then they send a care plan through to us, and we build it and we put in the agency that's available to provide it, right? So yeah, it's we're really crying for people. We need more workers, definitely.
Thank you. So we're going to switch a little bit of our focus to a different part of our health team, our home health team. I just want you to imagine that you're out in your morning walk down the Kinnickinnick Connector Trail and in the snow, and you slip and you have a bad fall, and you end up in hospital. Unfortunately, you fractured your hip. You go to Lionsgate, you come back to our hospital to complete your recovery, and life has changed. You need some help in your home. You were just fine before, but now you need a bit of help. And you're frightened to go home by yourself. You need the help. So I'm going to welcome Jessica next. She is our discharge coordinator, and she will meet you in the hospital and arrange all of your home support needs for you before you go home.
At home, you would thrive better. You're in your own environment. You're comfortable in your own environment. You're more aware in your own environment. And then with home support services, we can ensure that you can recover from home. We have somebody checking in on you. Somebody can help with personal care, with meals, with meds. And that way you can recover from home, and it's more beneficial to your health than being in a hospital. A discharge planner helps clients in hospital go home with home support. So I help people figure out what their needs are in hospital, and then I set up home support so that they can transition from hospital to home in a safe and effective manner. A discharge planner is important because I connect the home support with scheduling, and scheduling is very important because they schedule all our care workers to go into clients' homes. So without me working with them or between the hospital and the scheduling, it'd be very confusing, and it would be really hard to make sure discharges lined up with scheduling. So I kind of make that transition easier and close the communication loop, make sure everybody is where they need to be when they need to be as much as possible. Some things I look for when I'm discharging clients, their physical mobility. Are they independent? Do they need some assistance? Do they need a standby assist versus one person helping them? What do they use? Do they use a walker, or are they completely unassisted? I look at whether they have family members in the home that help them, family members outside of the home, friends outside of the home. So I look at all their supports. I also look at cognitive ability. Are they safe to be home by themselves? Are they safe to be home alone? So connecting all those pieces and then trying to supplement their care with home support services. I don't do much with home care nursing. Like, I'll let them know that your client's coming home, but it's more home support and connecting the home care OT team to the hospital OT team, like, and making sure everybody, like, there's like as much as possible, smooth transition from hospital to home. There's always going to be bumps in the road and things that don't go as planned, but hopefully there's enough of us to kind of problem shoot those bumps.
Chloe Delaney is our social worker with her community liaison workers, Kim and Alicia. And they're hands-on in our community, assisting clients with a variety of needs. As simple as sometimes just delivering food to a homebound senior, to conducting an abuse and neglect investigation. It's not unusual to walk into Chloe's office and trip over sleeping bags, bags of food, groceries, assorted housewares, all stashed in the corner, waiting to be delivered to someone in our community in need. This is such an important service that Chloe and her team offer, and we look forward to hearing more from Chloe.
A lot of what we do is helping folks with complex discharges because there's a lot of overlap from acute care into community. So we're able to see folks on both sides of that equation, which is really helpful. One of the main roles that I undertake in home care is the Adult Guardianship Act, which is the REACT program. And so it's doing complex psychosocial assessments to look at folks that may have some concerns regarding abuse, neglect, or self-neglect. And so those queries would come from community, they might come from families, or from the RCMP, and I would have the ability to go in there and dealing with people who oftentimes are not very familiar with healthcare services and haven't had a lot of exposure. So it's sort of a health navigation role in that way. We work hand in hand with the case managers here, also with the LPN supervisors, OTs, physios. We really work as a group, and if they have any specific questions that might be more appropriate for social work, they'd come to us and we would look into that. So financial issues are a big one, and especially with how things are going on the coast, and I think throughout the province, that we're having a lot of referrals come in, oftentimes for seniors with issues related to poverty and housing security or insecurity and food insecurity. So that didn't typically used to be a big part of the social work role, but it's extremely hard to ignore now, as there aren't any other resources specifically to help with those issues. So we're really often busy trying to help keep people, especially seniors, housed or help find them housing. And a lot of the emphasis, I think, for social work falls on the very practical. So it's things like making sure they have enough money to live and to, get the procedures or the treatments that they need, getting into the city. A lot of these things, especially coming from the Sunshine Coast, take a lot of work and a lot of negotiation to get the healthcare that we need. So we're able to support with that and work with the volunteer drivers. So advocacy is important. Finding funding, right? It goes hand in hand with that. Finding funds for folks. I think that's where there's a really huge gap, is that with the cost of living and the really big expense of having health issues, it's very expensive. If you take, for example, cancer, that can take over any savings you would have. And then we're able to luckily jump in there and try to look for whatever extra funding there would be or advocate for that. For example, with the Kidney Foundation, if someone is receiving dialysis, we're able to tap in there and connect with those other resources. A lot of what we do isn't necessarily in the job description, but it also isn't support available anywhere else. So we have these situations where we work really, really hard, again, to avoid long-term care for people, to keep them independent in their home. But without the supports of a family or neighbors, that's really challenging. And so that's where we spend a lot of our time with our local seniors. We're a totally free service, so there's no cost associated whatsoever. And referrals would come in different ways. So it could come from the family doctor. It could come from the hospital. You could self-refer or be referred by a family member, or perhaps it would come from the case manager or another member of our team. So they'd usually make a referral to me, either internally through our system, or even just calling one of us up and saying, hey, do you have a minute? Could we talk about this client? And is there anything in addition you might be able to suggest or do to support them? There are no costs related to having social work support or physio or occupational therapy. Those are all covered expenses, just like home care nursing would be a covered expense. So there's zero cost, which is great. And it's really, again, just whether you have a need that's qualifying and if we're able to support you. So it should be short-term, more of a transitional need for social work.
Before I proceed, I want to take the opportunity to thank the Sunshine Coast Healthcare Auxiliary for their financial contribution in sustaining what we call the Compassion Fund, which Chloe and her team make use of on a daily basis. As a result of these funds, we've been able to provide one-time emergency funding for incidentals, food, clothing, medical supplies, and lodging. So the Compassion Fund allows us to provide the help to people in crisis. So I just didn't want to forget to acknowledge the auxiliary for that. As we move along, I'm going to introduce Maria Stevenson, who is our volunteer coordinator, who leads the programs that rely on volunteers. And we're so fortunate on Sunshine Coast to have a dedicated group of volunteers who daily will deliver meals, take some of our clients to medical appointments, not only on the coast, but also in Vancouver. And I just don't know what we would do without them, and I thank them. Maria.
Our volunteers are the heart and soul of our programs. We currently have over 50 volunteers providing countless hours of invaluable work. Their commitment is truly admirable, and especially during those last couple of pandemic years that have been so challenging for everybody around the world, our volunteers continue to do their essential work, going above and beyond to help anybody in need. For example, in the last year, the Volunteer Income Tax Program helped over 1,000 community members file income tax returns. Between 2020 and 2021, our volunteer drivers with Meals on Wheels delivered over 10,000 meals to isolated community members. The most rewarding part of my job is knowing that our clients' needs are being met by a caring team comprised of qualified home care staff and our passionate volunteers. Every day, our volunteers make a difference in somebody's life. So if you want to be involved, if you want to contribute in a meaningful and impactful way, please consider volunteering with us. So you can email us at scvolunteer@vch.ca or give us a call at 604-885-8517. All of our programs provide services to our home care clients, but also to our most vulnerable community members. Whether individuals need a meal, groceries, a telephone wellness check, transportation to a medical appointment, or help filing an income tax return, our volunteers are here to support them. Their gifts, talents, and skills have helped over the years many of our home care clients remain at home for as long as possible. The Volunteer Drivers Program assists those needing transportation to and from medical appointments, either locally or in Vancouver. And with transportation being a challenge on the Sunshine Coast, this much needed service is essential to those who have no other means of getting to medical appointments. Our volunteer drivers provide rides that are safe, reliable, and affordable.
So I'm going to take you back to that incident of the fall, and you're just preparing to come out of hospital. Jessica set up all of your home supports for you, and you've been receiving some physiotherapy as assistance in the hospital, and it's been followed up. Referrals gone to home care, and so when you get home, one of our physiotherapists will visit your home and support you with your rehab going forward until you're fully recovered. And one of our physiotherapists, Helen, is here to speak today.
Our job is split sort of 50-50 between palliative care and wound care. So on a given day, we can see anywhere from 8 to 4 clients. It depends on what client needs are. So sometimes if there's someone who's really sick or closer to dying, they need a bit more time. So we spend sometimes hours, sometimes multiple visits with them, supporting the family and supporting the client. And then a lot of administrative stuff back in the office, organizing everything. And then some of the wound care visits are a little bit faster, but for the most part, that's how our day is broken down. Go out and do visits in the morning and then get back to the office and do all of the administrative phone calls, documenting stuff when we get back. Wound care is can be anything from someone who's caught their leg in a car door and needs wound care, that they're not able to get out to the ambulatory clinic. If they're not able to get out, then a nurse will go into their home and develop a care plan and help provide supplies and care. There are surgical incisions that have dehisced, there's ostomy care, there's all kinds of wounds that we're in charge of managing. So that's a weird specialty to have, but there's a lot of technological advancements there, so there's a lot of knowledge behind it. It's a strange specialty to have. But I still feel like it's Christmas morning whenever I take off a bandage to see what changes we have to make. So yeah, there's a lot of education that goes around with that too. That's a big part of all of nursing, I think, is just educating people on how to improve their overall health so that their wounds heal more quickly. I think people don't realize the importance nutrition plays. Well, our system is really good at responding to things, but we're not as good at being proactive at preventing things. So we're on the end of things where sometimes things have deteriorated. If someone has diabetes that's not very well controlled, sometimes they can develop wounds that we manage. Sometimes people who have poor circulation in their veins develop wounds on their lower legs. So we come on to help with that and put compression on. So if someone knew that they had some poor venous circulation, they could be wearing compression stockings or be a little bit more mindful about their salt intake and protein intake and how they can do a bit of exercise just to keep their calf muscle pumping. That's a big one. Keep your calf muscle pumping so it keeps your veins pumping the fluid back up to your heart. I am always grateful when I get to go into someone's home because I find the power balance is completely turned on its head. In the hospital, you don't get to wear your own clothes, you're not in your own environment, you are subjected to whatever the external schedule is. A nurse comes in and turns the light on, that's when you wake up, and everything happens to you. But in home care, it's your home. If you don't want us to come, you tell us to go away. You are in your home with your people, with your germs, with your clothes, your identity. It feels more like I'm coming under them to support them instead of over them to tell them what to do. And I was just talking to a nurse today about how I think you have to be more of a chameleon to understand how you can most respect people in their home environment and see what approach will be most beneficial for them so that they feel most empowered to make changes that can be beneficial. You have to be a chameleon, I think, to know how to come up with a plan and a conversation or communication style that connects with the person who you're going to help. Yeah, it's different than the hospital.
You may have noticed that wasn't Helen, that was Janice. My apologies, Janice, you have to love live feed. Janice said it all, so Janice doesn't even need an introduction. She explained what home care nursing and palliative service does so well. Thank you. So now we will move on to Helen, our physiotherapist.
I provide physiotherapy services for the whole of the Lower Sunshine Coast. We have 3 part-time physiotherapists who cover that whole area. We work closely with the rest of the home care team, especially the occupational therapists. We work quite closely together with them. Our service is based on referrals from family physicians, case managers in home care, clients and their family members. Our aim is to assist clients with meaningful functional goals, and that could be as simple as returning to walking after being non-weight bearing after surgery, or being able to get down the stairs so that they can get out into the community again. A major part of what we do is facilitate clients coming home from hospital back into their homes and becoming functionally independent again.
Well, usually, we initiate that contact through a phone call. And so we try to gain as much information from them as possible that way, so that when we come to do a visit, we can bring equipment or information, so that I can be prepared to make the most out of the visits. Because there's only 3 of us, we have a limited amount of time, so we want to make the most of it when we go see somebody. Our criteria covers those people who are homebound or who have difficulty getting out of their homes. For instance, people who have had an orthopedic injury and have been in hospital and they've been discharged home and they're just not able to get out the house yet. We also see home care clients who are receiving care, who would benefit from physiotherapy services going in and optimizing the care and helping in that way.
Hey, Shari, I'm just jumping back in here for a minute, just to give you a little bit of a break, because we wanted to insert a video. The physical therapists and the occupational therapists have all the kinds of cool gear, but our friends at the Sunshine Coast Healthcare Auxiliary also run a very little known a gem in the basement of the hospital called the Loan Cupboard. Let's take a look at that.
I'm Wendy. I'm a volunteer with the Loan Cupboard. The Loan Cupboard lends healthcare type equipment to residents of the Sunshine Coast on a short-term basis free of charge. It operates in a similar manner to the Red Cross in other communities. The Loan Cupboard is a service provided by the Sunshine Coast Healthcare Auxiliary and is staffed by volunteers. Training includes cleaning and sanitizing of equipment, as well as repairs and safety checks before it is put back into inventory. The Loan Cupboard operates Monday to Friday from 10 a.m. to 2 p.m., except for statutory holidays. We have over 700 pieces of equipment. Equipment such as walkers, bath stools, toilet seat raisers, wheelchairs, commodes, and bed rails. We don't stock crutches or orthopedic boots. There's a 250-pound weight limit when borrowing equipment. For a complete list, please check out the Loan Cupboard on the Sunshine Coast Healthcare Auxiliary website. Who can use our service? Hospital therapists and nurses borrow equipment to assist patients with discharge. Community nurses and therapists borrow equipment to assist their clients at home. But community members can also use our equipment and no referral is needed. For example, pre- and post-op surgery, such as hip and knee replacement, people with temporary mobility issues, such as caused by a sprain or a fall, people with long-term healthcare issues who may want to try out a piece of equipment before purchasing their own. Sometimes a client needs to borrow an item such as a wheelchair to attend appointments or to assist a visiting family member. It's easy to borrow equipment. Just phone Sechelt Hospital at 604-885-2224 and ask for the Loan Cupboard or local 4204. Leave a message with your name, phone number, and the equipment you wish to borrow. A volunteer will return your call either that day or the next business day and take the necessary details: the client's name, phone number, address, a contact person and phone number, and the equipment to be borrowed. You will be given a mutually acceptable pickup date and time. It is important to be on time, as the volunteer will meet you at the pickup parking spot outside the entrance to the hospital cafeteria to deliver the items. To return equipment, take the items to the old entrance to the hospital in the south wing and leave them in the area marked Loan Cupboard Drop-Off. It's important to note that equipment is used at your own risk. Each item comes with instructions regarding the Loan Cupboard contract, how to use the item, and installation procedures as necessary. The Hospital Auxiliary and the Loan Cupboard are very happy to be part of the continuum of healthcare on the Sunshine Coast.
Equipment, it's so important to supporting people as they return to their homes. Excuse me. Our next guest is Tom. He's one of our occupational therapists. And Tom is all about equipment, all about setting you up in your home, going and doing home safety assessments before you leave the hospital, making sure everything's ready for you, following up. It could be a could be a ceiling lift, a hospital bed, everything you need to keep you safe in your home. And welcome, Tom Grant.
Involvement of occupational therapy within home care services is very varied and diverse. The occupation part refers to any meaningful activity that someone might do in their day-to-day life. So this could be basic activities such as dressing, bathing, going to the toilet, or it could be more complex activities such as accessing the community or all the varied activities you need to be able to live at home independently and successfully. Occupational therapists will assess a person's physical, cognitive and mental health status and determine where they are having difficulties in their day-to-day functioning. So through a collaborative problem-solving approach, we will come up with suggestions of maybe adaptive equipment or suggestions of services and supports that a person might need in order to function successfully. So I've brought a few pieces of adaptive aids that occupational therapists may use. And again, you'll sort of see that it's very diverse, and so it's difficult to pinpoint exactly areas that we might intervene in. But this is a padded transfer belt to help someone to get up from a bed to a wheelchair, for example. So something we might recommend is a sling that would go together with a ceiling lift for someone who needs complete help getting out of a bed onto a commode for toileting. Something else, this is just an example of an adaptive aid that someone might use if you've got limited range of motion of your shoulder and you need help accessing to groom, to wash your back. This is a bootie that could be used for helping someone to prevent skin breakdown of your heels when you're lying in bed. This is a cutting board that someone with hemiplegia could use. You just need one arm to be able to cut your fruits and your veggies in order to take part in meal preparation. And one last item I have is a bath safety rail to help someone to sort of get in and out of the bath safely. So my role would be to come into the home and to see where someone's having difficulties with these types of activities and to make recommendations over adaptive equipment that someone might use. We also do things such as assessing people's swallowing difficulties, making recommendations around diet and texture. And we also work with wheelchair seating to prevent skin breakdown and promoting good posture while someone's in a wheelchair or scooter use for community access.
So as we make our way through the many services that we offer at home care, I'd like to speak briefly about our dietitian supports. Unfortunately, Lauren Capan wasn't able to appear, so I'll tell you a little bit about what we do. Home health dietitians, they provide clinical nutrition to adults 19 years of age or older in your home. Our services range from providing nutrition care to clients recently discharged from hospitals, to nutrition counseling for various conditions using individualized diets devised and monitored by a registered dietitian. We work with an interdisciplinary team of case managers, doctors, nurses, allied health professionals such as speech language pathologists, occupational therapists, and physiotherapists. And I believe the next spot on the wheel is to talk a bit about our cardiac rehab service and complex nursing care follow-up by the same nurse, and that would be our nurse Penny Brown. So Penny offers an exercise service that is in partnership with a fitness lead at both the Sechelt and the Gibsons community centers. And this is the Happy Hearts program is offered to anyone who is recovering from a cardiac event. And she offers this. There is a charge, a small fee, which I'm sorry I don't recall off the top of my head, but I know it's very reasonable. And this is certainly a service that's available to anyone in the community. And so next we're going to talk a bit about Brenda's program. So Brenda offers a program to support people with developmental disabilities in our community. And it's a little known service that people probably don't know that we have. But I'd like Brenda to tell us a little bit more about what she does.
I work with all the clients over the age of 19 who have a developmental disability and may have more serious health needs as well. So I've been in this role for Vancouver Coastal Health 18 years in this role, as well as doing other roles for Vancouver Coastal. We would be talking about patients that aren't necessarily even in homes. They may be in my group homes. So I have 5 group homes on the coast that that I basically do all the care plans for, monitor, do all the teaching for those group homes, the client-specific teaching, as well as the general education for all the caregivers. One of the things that I really have probably loved, we didn't have a really great exercise program for a lot of our people with developmental disabilities. So in 2006, I worked collaboratively with the SCRD so that they would house a program, and I worked with the Sunshine Coast Association for Community Living in order for them to be able to bring some of the clients to the program, because those are all the things that we end up facing is, yeah, it's all great to put a program together, but who's going to bring everyone? It's not like they can come on their own for many of these patients, right? So we created this program called Adaptive Fitness, and I've fundraised for it myself for the last, since 2006, every year. And so that's a program that the Hospital Auxiliary the last number of years has been helping me do, because before I was having to go out and do Rotary and Lions and you name it and everything, and it was so time consuming because it was all on my own time. And so the Hospital Auxiliary has been stepping up the last few years and helping me with the funds to allow this really important exercise program for people with developmental disabilities, so they don't have to pay because they're living on a disability pension that's very minimal. And so they don't have a lot of funds to do programs like this. So this is kind of an important thing to my heart for my patients.
Ha! Yes, the famous comment we've all heard 1,000 times on Zoom. You're muted. Sorry about that. So Shari, there's one big piece of information that we haven't touched on that we're going to touch on next week. If you wanted to give us a hint about that. Oh, now Shari can't hear me. Okay. I'm just going to go ahead then and promo that next week we will be talking about that enormous piece of care, which is about palliative. So we'll talk about palliative care, we'll talk about advanced care planning, we'll talk about the Greensleeve program, and we'll talk about hospice. So that's all next week at the same time. But now I know you've all been standing by with your questions, and the executive director of the Sechelt Hospital Foundation, Jane Macdonald, is patiently standing by with her many helpers to bring us the questions. Jane, come on down.
Hi, everyone. Thanks so much for joining us today. It is just such a pleasure to get a chance to showcase the amazing work that Shari and the entire home care services team does. We are we're just so thrilled that we're finally able to share one of the best kept secrets in healthcare on the Sunshine Coast. So we've had a few calls and a few questions come in. Shari, how many people in total are on the Sunshine Coast home care team, and are you recruiting, or how do you get more information about how to join?
I'm not sure if Shari can actually hear you, Jane, sadly.
Okay.
I'm sorry, I'm having trouble hearing. Yeah, I might have to actually bring the live feed closer, but there might be some feedback. Oh, the Skype speaker audio. Okay. Bringing my technical support here. Skype speaker audio. Bringing my technical support. Sorry. Okay. Okay, I'm sorry. Could I have the question again?
Sorry, they're asking about the size of the team, how many people actually work in home care, and then as well, are you recruiting, and sort of like a few questions about the roles of the care aides and how you sort of keep this amazing team staffed.
We're always recruiting. Yes, please contact us with any interest in physicians. This is very frustrating.
Okay.
I'm going to jump in a little bit here because I know that in the interviews, when we were editing the interviews, there was a lot of mention made of we're always looking for volunteers, and that some of the roles are definitely short-staffed. And so occasionally you will find that instead of a home care nurse employed here by Vancouver Coastal, there are agency nurses that are being brought in. So yes, absolutely recruiting all the time. I'm not sure if Shari can hear us again. Shari, can you?
I can hear you now.
Okay, wonderful.
Okay,
great.
Sorry.
Jane.
Okay, question. Shari, can you share a little bit more about what CAP University offers for our community in relation to home care?
I'll do my best. So Capilano University offers a community healthcare worker program. They're currently just finishing up a class. They will come and work with us in home care soon, and I believe another one starts in May. So you could call Capilano University and inquire. And I believe these courses are funded by the government currently. So it's a good opportunity.
Okay, a question from the audience is regarding what does community services do in all the spectrum of the different roles that were just on screen? What kind of gaps do they help fill? And can you share a bit more about how you liaise back and forth with community services and home care?
So community services, I always think that they fill the gaps that we don't have, services we don't offer. For example, when we offer home support to clients, one of the most common requests is help with housework, help with yard work. And unfortunately, these aren't services that we offer through Vancouver Coastal Health. However, Community Services has a program that does offer this support, and I believe it's the same payment type structure, a sliding scale, and it's called Better at Homes. So I would encourage anyone to contact them for this service. Hope that answers the question.
Sure. We have a very specific question on how do you do the hourly calculations, and is travel time, given how big the coast is travel time actually included as part of that hourly calculation for your fees?
That's a really good question. Thank you. So it is. So for instance, I know Monique spoke a bit about how your home care time is allotted. So if I determined that you needed 45 minutes for a bath, then and you lived in Pender Harbor, then I would add 45 minutes plus 30 for the travel. So it is included in the visit time, but depending on where you live, we make that determination.
Follow-up question here, Shari, as far as I know there's lots of calculations with eligibility, but how long can someone access home care services? And is there a cutoff period? And how does that work?
Thank you. There's no limit to how long you can access our services. We are there until you don't need us anymore. I mean, it is possible that you recover from, say, a hip surgery and you no longer need us. But we are with many of our clients until they pass. We provide palliative care until that time that they pass.
There have been lots of questions online regarding the materials that we went through today, and just wanted to showcase and share with everyone. We will be providing a link on our website to the reference materials, and as well that entire wheel. It is our absolute pleasure to finally animate the number of people that work with Shari's team, and we'll make sure that you have reference to that in the community. And we ask the community, if possible, to share this really great news with at least 10 friends. There's such a dearth of good news right now, and we want to give the community some confidence and knowledge in knowing that they are well surrounded and supported by this amazingly diverse and talented and compassionate team. And ask the community to share this information so that your friends and your neighbors, your caregivers and your loved ones know that by calling that number that goes directly to Shari's team, you will land with some very, very well supported information. That's all I have on my end. Thanks a lot, everyone.
Okay, thank you very much, Jane. And thank you for all of those questions. And Shari, thank you so much for being with us. And again, on top of your regular day job, you will be back with me as the co-host next week when we talk about palliative and, as I mentioned, advanced care planning, the Greensleeves Initiative, and also hospice and the role that all of those play in our community. As always, we welcome your comments and your recommendations and your questions about other topics that you might want to see in our next Med Talks. We try to do as many of these as we can to provide a service to the community. So one more time, Harmon's standing by with the Sunshine Coast Credit Union, our very generous sponsors for Med Talks. We'll take a look at that beautiful slide one more time and promote the fact that they will come to you as well. So reach out to the Sunshine Coast Credit Union for your financial needs, and we express our appreciation for their help. Thank you so much for being with us today, and we will see you next week, March the 15th at 4 p.m. in all of the usual online places. Bye for now.